All right, so I'm Eden. I'm one of the fourth year residents. This is my small talk. Get it? It's very small. It's going to be essentially like a little potpourri of pharmacology stuff. There will be some questions. That's why we have nearby. All right, so I'm going over some over-the-counter meds and some other commonly prescribed meds that we don't really, I guess, think too much about. This was inspired by a urgent care shift I had with Dr. Satabji, where we were discussing some medications that we didn't realize had some toxic effects. All right.
It looks okay on ours.
It's not working.
It looks okay on ours.
Oh, it's on your phone?
Yeah, it's on
Okay. All right.
Stop clicking.
Clearly, I've never used this before.
Please.
Okay. Cheers. All right, I'm just going to go for the answer. Okay, so the answer is Esalaam Pearls. So this is a commonly prescribed medication for cough suppression. The actual medication is benzonatate, which is kind of like a local anesthetic. Supposedly, it's very specific to the lung parenchyma. So when you take it, it kind of like numbs up the lungs and it decreases your cough. However, if you chew it or you let it dissolve in the mouth, it can actually lead to really increased toxicity of the benzonatate. That's why you have to swallow it, and it gets released slower through the GI tract. Toxicity occurs, again, usually you have to take at least a couple pills or so by mouth, either, again, chewing or letting it dissolve. And it can result in kind of seizures, and in some case reports, cardiac arrest. It doesn't happen that commonly, but it is a possibility. So it's just one thing. If you're prescribing it to your patients, I would definitely advise that they make sure that they swallow it, don't chew, or let it dissolve in the mouth. All right, next question. Anyway, I can hide the screen so they don't know.
Maybe you can click the bottom right,
Okay.
which is showing you.
There we go. All right.
We can't read the rest of the question.
No, you can tap it.
Oh, click it. Yeah.
That's it. Okay. Yeah, sorry, this is kind of a long question. All right. Okay, so the answer is pretty much anything except A. What these patients are on is Dextromethorphan. So this is actually now a more common drug of abuse. What you can do is I guess I could tell you how to do it, but there's a thing called Agent Lemon where you actually freebase the dextromethorphan and you get rid of all the extra, over-the-counter meds that are usually in it. In this case, you take NyQuil, you remove like the acetaminophen, and I think, what else do they have now? Phenylephrine or whatever else is in there. So you get pure freebase dextromethorphan, and then, kids are using this however they want. And obviously you're using lemon juice, that's what's called Agent Lemon. So in certain toxicity, especially if you're on an SSRI or an MAOI, then it can produce a serotonin-like syndrome. You can also get rhabdomyolysis, you can get seizures. I believe cardiac arrest has also been reported in the literature as well. What skittling is what it's kind of called on the street when you're using dextromethorphan, also known as robo-tripping, dexing, and apparently, you know, once adults caught wind of it, they decided to make this little informative thing to find out if parents knew about this. All right, next question. So this is like a two-parter question. So I expect that the EMIs will probably know this answer. So the answer is actually euglycemic DKA. Yeah. So euglycemic DKA can occur. We often don't think about it, but it was first described in type 1 diabetics who essentially have decreased carbohydrate intake, but they're still kind of taking some of their insulin, and they have some other insult which kind of tips them over into DKA. So that's why the sugar doesn't go very high, but they still produce the anion gap and all of that. Now this patient is a little bit different. I'll go into why later. But so it's not metformin-associated lactic acidosis. One, because there is doubt that that entity really exists. Most of the supposed mala was actually due to the biguanide that was preceding metformin. And since metformin was released, there are a couple scattered case reports, but a lot of people doubt that it actually exists. And usually it's associated with lactic acid levels that are much higher than the one in this case.
Sorry, why did you say that the glucose was normal?
It was like 139 or something.
Why?
Oh, yeah. So in this situation, this patient is on empagliflozin, which is one of the newer SGLT2 diabetic medications. So in that situation, they pee out the extra glucose. So that's why they remain euglycemic, but they're still in DKA. And usually it's preceded again by a little bit of decreased carbohydrate intake, and in this case, the patient was vomiting a lot as well. So that is the answer there. Okay, next question. So the answer here is cyclopam. So this is kind of a classic presentation for flexural toxicity. Now, usually you get very drowsy, sedated. Obviously, if you take a large enough amount, then it can kind of present almost as if it's like an opioid overdose. And there are some case reports that said that naloxone may help a little, but again, not really the antidote for this patient. Treatment is just supportive, really. It can have some another drug of abuse in a sense. So the promethazine with codeine syrup is mixed with Sprite and Jolly Ranchers, and it's called all that stuff that we mentioned. I actually saw a patient in urgent care that kind of said, oh yeah, you know, the only thing that works for me is that. So obviously we did not do that today. But yeah, didn't really have a cough or anything, but you know, this is this is also what causes Lil Wayne to have a seizure. You know, if people still use it. All right, next question. This is kind of just like random trivia. I doubt anyone would really know this. If you do, kudos. I don't know why you know this. It kind of breaks up mucus a little bit so that you can kind of clear it. So in certain case reports, it seems that it actually increases like cervical factor for females, and for men it also increases motility of sperm. I'm not sure if there's mechanistically something, you know, with the mucociliary clearance or whatever, but supposedly that's how it works. So imagine, you know, you're a gentleman who has some issues with fertility, right? So that's your brown dog right there, your little sperm. If you take blood medicine, supposedly you will be like the other dogs and be able to swim a little bit, your sperm will swim a little bit better. All right? Okay, next question. This one is not quite as applicable to EM just yet, but you know, this is kind of on the horizon.
Looks like you're trying to chicken.
Hope most of you guys get this one, right? Because I made some pretty ridiculous choices. All right, so this is the Klebsiella pneumonia carbapenemase. So this is one of a group of very multi-drug resistant bacteria. Overall, they're called the carbapenemase resistant Enterobacter. One second. So, for the last patient, what options do you have? And there's a little bit of video for one of the answer choices. This is also something I expect the EMIs to know. And this is kind of a sort of a trick question as well, because this actually has multiple answers. It kind of depends on the culture. So just because it's resistant to carbapenem doesn't mean it's not going to be resistant to some of these drugs. Now the ceftazidime avibactam, it's a relatively newer produced antibiotic called, I think it's Avicaz is the brand name. It was specifically made in order to combat these, you know, resistant bacteria. Polymyxin is also a medication used for a lot of these multi-drug resistant bacteria. And I think that would be others.
You can use any of them as long as
Yeah, so it's, again, you have to follow the cultures of these. But if you are empirically treating because you know the patient has a history of it, then one, if you could get them to ED, that'd be great. But you know, any of those choices would be a fine initial therapeutic option. This is one of the bacteria that you've been seeing in the news, patients dying of, like none of the antibiotics work, et cetera, et cetera. So it is something that is scary and on the horizon. So this was a little infographic today. I forget where I found this one. I think it was CDC or something. So essentially, it's a very high morbid condition. Usually, it seems to be in the urine or intra-abdominal infections as well. Okay, next question. I think this might be the last one. And this isn't so much EM related, but it's something that is quickly becoming standard of care. So more and more of our patients should be on this medication, but they aren't. So this one is liraglutide, also known as Victoza. So the way this works is it slows gastric emptying, decreases glucagon secretion, as well as increasing insulin release. In the LEADER trial, it was shown to actually decrease the risk of cardiovascular events in diabetics. And they compared patients taking this versus patients not taking it either, and most of them were on already either metformin or sulfonylurea. With the number needed to treat it, I think it was like 77 or so. Not terrible, but it was the only medication at least shown in RCT that would actually decrease the risk of cardiovascular events. Probably does need to be externally validated though, but sort of this is some of the best data we have for it. And that is my last question.